How can your midwives tell if all of your placenta has come out after birth? So what will happen is when your placenta is birthed, your midwife will check this all over. They'll be checking the vessels in the cord to make sure that there are 3, unless it's already been identified that you had 2 during your pregnancy on your scans. They will be having a look. They'll take any blood tests that they may need at this stage, for example, like blood group or any sort of full blood count if you've had low platelets in your pregnancy. This may also be where you have your stem cell collection if this is something that you are considering and have arranged privately. They will then check the membranes and see if there have been 2 membranes, so the chorion and the amnion, and then they will check the placental side that's been attached to you. Now this looks like piecemeal, and this is a picture of my own placenta here. And what will happen is you'll lay it out flat and you'll be looking and feeling to see if there are any missing gaps within the placenta. It's not 100% accurate, and I will hand on heart say that you can't always 100% tell if it's all there. The reason being, we don't have a photograph of what your placenta looks like when it was inside you to when it was outside. But by looking and feeling, if there is a gap or a lobe missing, it's quite easy to identify if it's slightly bigger and if it doesn't sit together well. Or if there is a part that's obviously missing, or you've got really ragged membranes, so the bag of waters that comes out, we also check to see if it looks complete or if it's come out as like one big long string, for example. Now there are 2 risks for having something that's left inside. One is bleeding. One of the first things we do when women and people are bleeding too heavily is to check the placenta, because if the placenta does not appear intact or there are ragged membranes, so we don't think the membranes, the bag of waters around baby are complete, then we may be giving additional medications, and sometimes that helps the rest of the membranes or that piece of placenta pass itself. Sometimes massaging the fundus in your uterus also helps expel any parts of the placenta or any clots too. Now the other risk of the placenta not being complete is developing an infection a few days later. So if there's an obvious part of the placenta that is not there, or for example the membranes are really ragged, you may be recommended to have a course of oral antibiotics to help reduce the chance of infection, but also sometimes that helps it pass too. But in the most part, it is looking at your placenta as a whole, feeling it, seeing if it sits together, or seeing if actually that looks like it doesn't quite go there and it looks like there was a missing part. Sometimes a chunk of placenta can be quite obvious to see when it's a large chunk of placenta. More difficult ones to tell is when you've got a subcenturiate lobe of placenta, which is what my placenta looked like, where there will be a gap because the membranes are here, and when there's an extra part of the placenta over here. Sometimes they're more difficult because you don't know whether there was any placenta in between the main lobe and the small lobe or not. This is the same checking whether you have a caesarean birth, a ventouse, a forceps, or a vaginal birth. The caesarean birth or manual removal, the whole placenta is removed by the obstetrician putting their hand in though, so it should all be complete once it is removed, assuming that it's not a placenta accreta that is really well adhered and stuck to the uterus.